It is my great pleasure to introduce Angie Grover, Chief Operating Officer of Metopio. Angie brings more than 30 years of experience working with healthcare, nonprofit organizations, and governmental organizations. In 2019, Angie co-founded the company with two of her colleagues to bring innovation and automation to workflows and processes in public health and healthcare. Metopio is a user-friendly community intelligence platform that curates data, delivers insights, and helps organizations better understand the places and people that they serve in order to have a positive impact. We are grateful for Metopio for contributing to Tuesday evening's reception for our data modernization pre-conference participants and for being with us today. Thank you so much. Please help me welcome Angie Grover.
Good morning, everyone. Thank you, Ava, for that great introduction. As she says, I'm Angie Grover. I am the co-founder and Chief Operating Officer for Metopio. And in the past few days, I've been inspired, as all of you have shared, the progress and the journey you've been on as PHIG recipients, and we're so grateful to have the opportunity to support this important convening. So today, we're going to focus a little bit on that local-state relationship and shared intelligence in the public health space. And as Ava mentioned, Metopio is a data platform. And I'll share a bit more about that in our time together today. But before I do, I really want to acknowledge that every data set that we work with represents real lives, real communities, and real opportunities to drive meaningful change. It really is a vibrant and ever-changing conversation that we should be having. And it underpins the work that we do here at Metopio and the work that a lot of you do every single day. So for those of you who haven't met Metopio, it's nice to meet you. We are a purpose-built platform that aligns with the foundational work of the Public Health Infrastructure Grant. We are built for today's priorities and tomorrow's opportunities with curated, verified data from federal, state, and local sources, while allowing you to add that hyper-local proprietary data to the platform so that we're creating that space for your data collection. We have industry-leading automation that can create visualizations instantly, so your time is not spent doing graphic design. Your time is spent doing the storytelling. I know how many times I'm so glad that I don't have to edit PowerPoint slides anymore. We are ready-made for the opportunities in collaboration. So in North Carolina right now, we are working with 10 public health departments and 27 hospital facilities who are collaborating to collect data together, yet they're all able to create their unique assessments for the places they serve, but clearly identify those opportunities to leverage their limited resources and work together to have collective impact. Our automation also creates chaws and chips and less time, creating the space for you to implement your programs and be in community doing the important work that really requires one-to-one engagement. The platform modernizes these systems and aligns with the PHIG foundational elements. It expands workforce capacity to understand and leverage data across departments that you work with. We have everyone from community members to PhDs who work on the platform. And I always joke, I'm not a data scientist for the record, and I have a 14-year-old who's on day 2 of school, and he is learning Python. And before I started in this industry, for me, that was a snake. So I can use the platform, and my friend who teaches at the University of Illinois at Chicago has got a PhD and many other letters after their name, is also using the platform. That really ubiquitous access to data is what we're aiming for. We also address gaps in data equity. So often we work in community, and those with lived experience don't have access to the data. So they can't advocate for themselves or point out where they're not being seen in the data. So having access and effectively sharing data builds towards a common language and an understanding of what data can and cannot do. So there have been quite a few buzzwords in the last couple days. AI and sustainability are two of those. I have a couple more during this presentation. But when you foster collaboration and bring valuable data to the table, you can uncover unlikely allies, entities that want to buy into the important work that you are doing, and help you with that braided funding, which is core to sustaining the important work and the shared values that we all have. And it goes without saying that the pressures are intense. As we recognize the shooting at the CDC and the reality of that, and recognize the impact that had on our colleagues, this is an extraordinary moment of possibility, but also pressure for public health. And we know the PHIG investments were necessary, clearly, but now they also seem very prescient. Through your initiatives and your leadership, we are trying to address the intense and persistent pressures, such as fragmentation of data. And here in 2025, we are still trying to talk about how we can take these old siloed systems that don't talk to each other and integrate data with a common language and curate it the same way so that it's interoperable and accessible in real time. We're trying to avoid duplication. We work with a lot of large health departments, and in a community, in a big urban area, let's say like Detroit, there might be 40 different organizations all curating that same data set, pulling down the ACS data set or the CDC data set and solving the same problem without even knowing that each other is doing the same work. We have capacity constraints, and that's really what that PHIG foundational element of workforce is helping us address. And it's added some really incredible talent across the landscape of public health. But if we have these local teams disconnected and not able to communicate with each other, and they don't have a sustainable infrastructure, how are we going to hold on to this talent and help them see us into the future? It goes without saying that urgency, the next crisis is not going to wait for us. And it's not going to wait for us to build the connections we need to have to see it coming, whether it's with wastewater surveillance or policy changes, and being able to clearly communicate the impact that policy changes have on the important work we do. And another really important conversation is that conversation of data disappearance. And we still need that consistent, reliable data to inform our work and measure our impact. But as the new administration came in, many of you, like myself, we went to look for that data set, and we got the 404 doesn't exist anymore. And it was a wake-up call. We never thought that we'd end up going to pull down a data set we relied on, and it just wouldn't be there anymore. And so we have seen that slowly come back, but maybe in a different form, maybe in a more limited way. And while we assumed that it would always be available, now we have the opportunity to look at how do we take that on for ourselves and make sure that we have the ownership and the data we need to drive our work. So what I've heard through all of your presentations and our conversations in the hallway is that we have a lot of possibilities to transform our work. Real-time, bidirectional data flow across jurisdictions is possible. And yesterday, my colleague Will Snyder talked about this with the Louisiana Public Health Institute, about how building the right data sets and being sure there are ways for communities and partners to access and understand them makes the work more robust. And that we have flexible local innovation, that we look for how we can work together around these frameworks. And while public health looks different in every state and every jurisdiction, the relationship between what's happening on the ground and the decisions that need to be made at higher levels of government must be connected. So what if? There's lots of opportunities, and we've talked about those, and we've seen how you've put those what if statements into action. But what if every local health department could instantly build their dashboards and reports at the push of a button, customized to their community, automatically contributing to a statewide view? And then what if those states could see in real time what's happening on the ground, what gaps exist, how to deploy some resources and get to scale without manual updates and endless repetitive work and reconciliation? So this isn't a pilot. It's a proven framework that Metopio has refined through more than 450 communities across the country, partnering with public health, healthcare, CBOs, CCBHCs, you name it. We're all part of the solution. So I love that this conference is in Missouri. My sister lives here, and it is the Show Me State. So what I'm going to is take the next few minutes of our time together and actually show you what this looks like and what is possible. So I'll start with from working in those 450 communities, both public health and healthcare partners, I wanted just to reflect on some of our successes and some of those lessons where we see that if you leverage them, it can really make a difference. And that local ownership fuels participation. When you empower your communities and they can highlight their neighborhood priorities, and we see participation rise dramatically. You can build that sustainable ecosystem that includes your CBOs, your mental health boards, United Way is always at the table, your planning commissions. There's lots of others to help you deliver on your plan. And that consistent frameworks prevent drift and reduce friction. That's what we're trying to do with technology, is reduce that friction. And the common structure of a plan or a platform reduces friction, but it doesn't have to eliminate customization. I've worked in every state except for Idaho. Any Idahoans in the house? If you know of anybody in Idaho, I need to get connected in Idaho. Let's say you've adopted a framework. The state of New York uses the prevention agenda, or maybe you're leveraging the Healthy People 2030 framework in your state. Setting that baseline provides for data consistency, but it also allows for you to create this shared intelligence. And automation frees human to do human work. What I love about public health, it is in community with individuals. And so our goal is really to automate the things that can and should be automated, which will free you up so we can provide instant secondary data insights, update your analyses, so that your team can focus on community engagement and primary data collection and other work that really should be that one-to-one interaction. And finally, I'll just say scalability matters. This is how we get to sustainability. The capacity and connectivity and getting to scale, if we can find a way to do that, we can be more efficient. And we recognize how diverse public health is. But whether you have a team of 25 epidemiologists or maybe just one on contract, technology should be flexible enough to deploy with any agency configuration, with any number of collaborators, so that you can get to efficiencies of scale. So I'm maybe about 10 minutes in if I'm not talking too fast. And I'm going to follow suit and use the buzzwords I mentioned at the top of the presentation, which is AI, one of them. Anyway, we should have played AI bingo because I'm pretty sure it was said in every presentation I've been at so far, and for good reason. So let me address it. Of course, you can simply jump into and use your favorite open AI. You can have some quick wins. There's definitely low-hanging fruit for sure. But if you want results from AI, you need to empower it to help you with the time-consuming parts of your work. So summarizing public health findings, writing those reports, drafting your grant applications, automating your daily tasks. But let's remember that AI is just a computer program. And it can't tell the difference between a dog and the blueberry muffin on the table out there. That when you connect it to public data sources without any guidance, it's going to build you a very impressive data dashboard about the wrong Springfield. It will entirely make up a community of residents and their current concerns to give you what you asked for. And most importantly, it does not have the faintest idea about what it means or feels like to live in your community, to be in your neighborhood, or how you compare to the town next door. So Metopio has deployed AI that is purpose-built for the important work that public health does. We are structuring it to avoid hallucination and unreliable outputs, no confusion between blueberry muffins and puppies. And we can help you leverage the data that you are all creating and collecting with vector databases and prompting and models that are necessary to work the way that you work, and give you the confidence that the answers that are being delivered are from data that actually exists. So how are we transforming your day-to-day work? This is the superpower of AI and automation. In some ways, it's like a junior collaborator who can write most of your CHA in an afternoon while surfacing insights you might not have had the time to identify otherwise, producing a beautiful branded visualization with captions and citations, and lift up those cross-cutting themes and uncover and identify patterns. Using the criteria necessary for an assessment or for a report completion, it will draft your document to meet the requirements that you need. So your job is to review, refine, and finalize your document that really is going to drive the work that you do. So as I said, we're in the show me state, so I'm going to show you. This is Metopio's community health assessment automation. The secondary data is automated with whatever framework you desire, and the community can always go beyond that. It ensures that you'll have every element necessary to complete the MAP 2.0 process, your IRS checklist, your FAB requirements. Each insight is created with your brand specifications, with those captions and citations. So your work is really analyzing, not editing, not designing. You can deploy or collaborate with partners to collect the primary data, talk to the community, and AI is really good at summarizing and categorizing that lived experience along with your framework. Then we can use AI to help draft that report, which means we are pulling in all those steps in one place. So again, your job is editing for tone of voice, incorporating your community voice, making sure your priorities are reflected, keeping the human in the driver's seat to make sure the report reflects your efforts. And then we move beyond the dashboard. What is really exciting about this technology is we take that community report and turn it into data that your community can actually access, giving you a common language that aligns with your goals and objectives and empowers your collaborators and partners to bring more resources to the table, to address the priorities you have set forth in the community, to build healthier, more resilient communities. So no longer is this a static PDF, but you're empowering your communities to understand this data, use it with confidence, and help you achieve your goals. And what used to take months and months and months, and I know because we've drafted a million of these, it seems like, now really only takes minutes. So this is a holistic process, right? We understand our community, and then we design action to have impact. So after the CHA, AI can transform the way that you develop and implement your chip. So many of our partners were exhausted by the time they were done with the CHA. There was little left to really invest in creating the chip. And that's really where the real work happens, right? So obviously, we need data to inform our priorities, yet we really need the effort and enthusiasm to craft and implement the programs that will address the priorities that we all decided on together. So Metopio's platform is crafting a continuous improvement cycle, allowing you to take your priorities from the CHA, move them into the chip, and develop that chip with our large evidence-based program library that offers more than 300 programs and grows with public health departments' engagement, sharing what works, just like at this convening. If you've got something that works, we're able to share that. Sometimes it gets validated, it's peer-reviewed, or it's evidence-based. All of that is at your fingertips. And these are delivered with our logic model templates that can take you either from the initial step of idea through development to measurement, or can help you quickly adopt one of those other programs and customize a proven program to scale in your community. So we leverage AI to then draft your chip. So again, you're using your time and expertise to build those deep, meaningful relationships, and your job is to review, implement, and track progress towards your goals. So what else does that give us? So we've been on this journey together this morning, creating a community health assessment, creating our chip. We've done it in a fraction of the time that it typically takes. So what other opportunities does that open up for us? So I want to add another buzzword. I have two more in my presentation, and this one is collaboration. And I've heard it in pockets of conversation across this convening. But as we look for opportunities to deploy Metopio at scale, we see the opportunity for critical, timely, shared intelligence. So let's say you're the state of Wisconsin. I don't know if I have any Wisconsin friends in here, but I believe they have 86 local health departments and 12 tribal health departments. So by providing them with a framework and the technology, you don't need 12 different systems to complete this work and report on it and action it. You could be creating shared intelligence. So the title of this presentation was Flexible Locals, Focused States, because we know there's that interdependence between jurisdictions that we just need to have to even scrape the surface of the work that public health is asked to do. So we have seen that when the same technology is adopted, opportunities arise for real-time insights and meaningful collaborations. And let me just give you an example. So both Cook County Health and the Chicago Department of Public Health have adopted Metopio and use it to share data with their communities. Chicago has been running a comprehensive survey for the past 16 years. It's industry leading. It's called the Healthy Chicago Survey, and it just covers the city of Chicago. This is a really rich, hyper-local source of data. You can see it on the chicagohealthatlas.org. But if I work on the west side of Chicago and in Oak Park, which is a mere, a crossing of the street, the data drop-off was significant. So people in Cook County were not getting the insights that people in the city were getting. So by launching their respective atlases and beginning the conversation, Cook County was able to move forward and actually take the Healthy Chicago survey and provide that and deploy that in their community. So now they have regional insights and data continuity across jurisdictions that are all working with similar populations and similar cases. They now have a collaborative data meeting to gain insights, to talk about what they need, how best to collaborate, how to ensure that they have the data they need and the context to work in these complex neighborhoods, and share with stakeholders and community members, really to understand and address the drivers of poor health outcomes and find opportunities for impact. This shared intelligence provides a richer, more robust understanding of community without complicated and competing technologies. So what can that data show us? I'm going to do some more show me's. Again, this is progress at scale. So if we're tracking progress and aligning stakeholders across local health departments, across jurisdictions and counties, we are going to have a very clear view in real time of the coverage and impact we're having. This allows us, like never before, to immediately spot gaps and coordinate action. So I'm going to show you what that looks like. By deploying at scale and providing guidance for CHIPs, you can develop programs that are on the ground, ready to go, and roll them up so that you can see where are we making progress. You can quickly customize your view to answer questions of key stakeholders. For instance, where we want to look at access to care and maternal child health. Where are those efforts overlapping? The tools and templates are easy to use in this interface, and it allows you to dive deeper into those programs in real time and understand what does it take to make them successful, what kind of progress are they making, and what community is best suited to adopt a program. This kind of shared intelligence will help you figure out and deploy your valuable, limited resources, determine what's missing and what needs more attention. You can ask what priority isn't being addressed by the local efforts and maybe strategically design your statewide initiatives to complement and coordinate with these ongoing efforts. We also, again, open ourselves up for more strategic insights. So what else can you do with the data now that you're collecting it? This is where we're, again, deploying purpose-built AI to leverage the combined assessments and improvement plans to deliver the ability for you to query your data on the fly. These programs are being managed and updated, so you can use this as a resource to answer questions that come to you. You can layer on your secondary data. Now we've got all that primary data collection, we've got all that secondary data. For instance, the top example is, where is substance use disorder high? And what identified strategies are there at the local level? So maybe if we had grant dollars to deploy and wanted to prioritize substance use disorder, we could easily tap into these resources across the platform. Or maybe you needed to develop a grant document across the state of South Carolina. You can summarize and categorize what work is happening and where your strategic planning can have the best impact with your grant submission. Finally, you can get all those visualizations you need with a query to give you a beautiful insight and tell your story. So PHIG funding has given us the opportunity to address the barriers that stand in the way of more powerful public health work. From strategic on-the-ground implementation with key investment in workforce to ways to look at how we sustain our future. This really is the difference between the silos and repetitive, duplicative work that consumes more than their fair share of our time and resources and delay us on action. With an easy integrated approach, connected technology can spur collaboration, bring more people to our public health mission, create real-time shared intelligence, and accelerate action for improvement in the communities that we care about. So as this is the last time we'll have breakfast together, I just want to say that I'm inspired by the progress that I've seen in the innovation and partnership you've all brought to the table. I've touched on the buzzwords of AI, sustainability, collaboration, but there's one more. So to wrap up, I'm going to add one more to our bingo card. And what I've heard is steal. And I can't end my presentation on a negative note. So I'm going to say borrow. We're going to use borrow. Because borrowing great ideas means they're working. And I wanted to pivot to that positive because that, my friends, is scale. Scale is one of the best things about working in public health. You all have been successful. You want that to be seen, recognized, and put into action into communities where it can really make a difference. So looking at the agenda today, it looks like there are still some really great ideas to borrow and lessons to be learned. And I really appreciate the opportunity that the team here at Metopio has to underpin the important work that you are leading to reduce the friction and bring more people to the important public health that you are working to make a difference in the communities you serve across the country. So thank you for your endless energy. You're all here this morning. I appreciate that. Your commitment to ensuring that everyone in our communities has access to the resources and opportunities they need to be healthy and live up to their full potential. And if I've struck a chord with you or any of this has excited you, because you know now you can get these insights with just a few clicks on your computer screen, there's more to share. And I want to know about the work that you're doing. So we're right outside in the hall, and we'll be here before you head off to your next session. I'm just so grateful for the opportunity to be with you, and I'll let you enjoy your breakfast. Thanks so much, and please continue the great work that you do.